Hello everyone, welcome back to this channel. Have you heard of any of the middle-aged individuals complaining of pain or numbness around the wrist, hand or sometimes the entire upper limb? Well, they may be suffering from a condition called as carpal tunnel syndrome. Now in this video, let's look at this condition in detail. Do make sure you watch this video till the end so that you get all the important information about this condition and may prevent some of your near or dear ones from having a complication arising out of this condition. Carpal tunnel syndrome is a very common peripheral nerve entrapment syndrome. Okay, don't worry about all the technical jargons. Now I told peripheral nerve entrapment. Now let's look at it word by word. Peripheral nerve. Now our nervous system is divided into a central nervous system, which mainly consists of brain and spinal cord, and peripheral nervous system, which consists of the nerves arising, of course, from the central nervous system. So in short, the nerves in the periphery or in our extremities are the peripheral nerves. The second word was entrapment. The word is self-explanatory. It just means getting caught under something. So basically, peripheral nerve entrapment is peripheral nerve getting caught and getting compressed under something. This can happen at different parts of our body, and the most common site is at the wrist, called as carpal tunnel syndrome. Now let's understand the word carpal tunnel syndrome as such. The word carpus refers to wrist. Now our wrist has 8 small bones called as carpal bones. Now these are the list of the bones present at our wrist. And then there is a fibrous band covering over this carpal bones, with its attachment on one side on the pisiform and hamate, and on the other side on the scaphoid and trapezium. So now, as you can see it, there are these set of carpal bones underneath and this fibrous band. This fibrous band is called as Flexor retinaculum. So there is this Flexor retinaculum arching over this carpal bones. So effectively, this forms a tunnel-like structure. That is why this is called as carpal tunnel. Before we proceed further, you need to understand some of the terms that we use in our medical language. Now, what is a hand? In day-to-day usage, we say this entire thing as hand, right? But in medical language, this is hand, while this is wrist, this is forearm, and this is arm, while the entire thing together called as limb. So in medical term, hand is not the entire thing. Hand is this. So coming back to the carpal tunnel, there are a set of structures which pass through this carpal tunnel, that is below the flexor retinaculum, from the forearm to the hand. Now, one of the most important structure that passes through the carpal tunnel is a nerve called as median nerve, which of course is a peripheral nerve. So, as is clear from our discussion, carpal tunnel syndrome means compression of the median nerve as it passes through the carpal tunnel. Now this can happen because of various reasons. Some individuals have a congenital narrower canal, and in some there may be thickening of the flexor retinaculum compressing the median nerve. This again can happen because of various reasons. Now some of the other common causes include inflammation and swelling of the adjacent structures which pass through the carpal tunnel, which are mainly the tendons of the muscles, or some abnormal tissue growing inside the carpal tunnel and hence compressing the median nerve. Now, in addition to all these, there are a few systemic conditions which make the patient more prone for developing carpal tunnel syndrome. Now, these are the set of systemic conditions which do so. Okay, now that you know that the median nerve gets compressed in carpal tunnel syndrome, you need to know what exactly happens because of the compression. This median nerve carries sensation of this part of the hand. Now, in addition to this, it also has motor function. That is, it is responsible for few specific movements of the fingers. Let's not go into the details of that. But the most important being movement of the thumb. And all of us know how important the thumb is for any activity using the hand. Now, when the nerve gets compressed in the carpal tunnel, there are different changes happening inside the nerve. And the first one is swelling or edema, which happens in the nerve. And as this progresses, it leads to ischemia or damage to the nerve. Now, in the initial phases, patients tend to have pain and tingling sensation around the wrist or hand, or sometimes because of this swelling, they may experience this condition in their entire limb. If it is left untreated, eventually there is what is called as demyelination of the nerve. That is, the covering of the nerve gets damaged and the signal transmission through the nerve gets affected. Now, this is when patients start having some serious problems. That is, they start developing weakness of the thumb. And a very good indicator of that is this part of the hand. This is called as the thenar eminence. So as the thumb becomes weaker and weaker, the muscles which are responsible for this bulk, that is thenar eminence, get atrophied and this part becomes flatter and flatter. So eventually patient may lose all the function of the thumb, and that can be really disastrous. So it's important that the condition needs to be treated and corrected before the patient starts developing weakness of the thumb, because the weakness of the thumb once developed can be irreversible. There are some quick clinical tests to diagnose this condition. Of course, in addition to examining the sensory and the motor system of the hand, they are Tinel sign, Durkin compression test and Fallon test. But it's important to note that these tests are suboptimal in their sensitivity and specificity. The most important test to diagnose this carpal tunnel syndrome is nerve conduction velocity testing, that is NCV. Based on the NCV finding, carpal tunnel syndrome can be graded from 1 to 5. Now, initially, when the disease is mild to moderate, patients are given some medications, which are these. Basically, these are symptomatic and sometimes may halt the progression of the disease. Well, if the patient has severe carpal tunnel syndrome, that is grade 5, then it needs to be treated surgically so that the patient doesn't end up having irreversible damage to the thumb. The surgical treatment of carpal tunnel syndrome involves a minor operation called as carpal tunnel release surgery. Now, what we do is under local anesthesia. Mind you, it is not even under general anesthesia, it is just under local anesthesia. We give a small incision at this region. We reach till the flexor retinaculum and then we cut open the flexor retinaculum so that the underlying structures in the carpal tunnel are decompressed or are free from the compression. Now, this is how it is done. This is the flexor retinaculum, and here I am cutting the flexor retinaculum so that the structures underneath are decompressed. So these are the two cut edges of the flexor retinaculum, and as you can see, the structures underneath are fully free from the compression now. After the operation, patients usually respond well. That is, in case if they have severe pain, usually the pain disappears immediately, and the other symptoms like tingling, numbness, etc. take some time. Maybe it may take around 4 to 6 weeks, and then they usually settle down. Well, it may not be the case in 100% of the individuals. That is, some patients may have some amount of residual tingling or numbness, or may even have some amount of residual pain after the operation. Some of the rarer complications include persistent pain at the surgical site, or wound infection, which of course can happen with any wound, or a neuroma formation, or recurrence of the carpal tunnel syndrome. That is, even after the entire structures in the carpal tunnel are decompressed, after some time, because of the healing and fibrosis, this can happen again. And that is when patients have recurrent carpal tunnel syndrome. So these were a few important points about this small yet important topic, carpal tunnel syndrome. I hope this video was informative to you. If so, give it a thumbs up, share it with your friends and family. And for more health and wellness related videos, subscribe to this channel. Thank you.